Hi, so I'm Aditya. I'm be presenting on the effects of Vigabatrin in hemorrhagic shock-induced endotheliopathy and subsequent glycocalyx shedding in the lung. So this is a trauma model. So what we're basically looking into is hemorrhagic shock and how to mediate some of the downstream effects that it has on the endothelium. So hemorrhagic shock is often the consequence of trauma and contributes to the morbidity and mortality of patients, all who experience it. And shock-induced endotheliopathy has specifically in recent times garnered interest, especially since there are molecular targets that can be activated and used in this paradigm. So this specific experiment is looking at what Vigabatrin, which is an FDA-approved anticonvulsant that inhibits GABA transaminase, can do in preventing the metabolism of GABA to succinate semialdehyde and subsequently to succinate. And succinate is it's the evil person in this whole paradigm. It accumulates in tissues during hemorrhagic shock due to the electron transport chain decoupling and is a direct and independent predictor of death, likely due to its production of ROS or reactive oxygenated species. So our hypothesis is that when we give the Vigabatrin, it should prevent the buildup of succinate and thereby provide better physiological recovery following hemorrhagic shock. So the way we went about testing this is in a rat model. So what we did was induce hemorrhagic shock and resuscitate the rat by putting in a jugular line as well as 2 femoral arterial lines. And we basically give the drug, we see what happens, we wait, we take time points, and then we analyze the serum using ELISA. So in this specific experiment, a control group of 5 with no Vigabatrin treatment following hemorrhage and resuscitation was compared to a group of 5 that did receive Vigabatrin and subsequently had hemorrhage and resuscitation. So after the 30-minute period, both groups were resuscitated with lactated ringers. The only difference was one received Vigabatrin right before resuscitation and one did not. And all lung samples were taken from the same spot, which was the right lower lung lobe, it's a lot to say, of each rat. So glycocalyx shedding, unfortunately, was not improved in the Vigabatrin treated group. So this is exactly against our hypothesis. And in fact, it actually showed that there was enhanced glycocalyx shedding in the Vigabatrin group compared to the hemorrhagic shock resuscitation group, the control group. So you kind of see, it's a little blurry, but the graphs here, you see the sham and the hemorrhagic resuscitation. The green is the endothelial glycocalyx, which is shed, and that's what is lost during hemorrhagic resuscitation. So here we have the glycocalyx, it's healthy, it's nice. Then this is in hemorrhagic resuscitation, it's kind of lost. And this is what it looked like in the Vigabatrin. It was completely shed and there's no green, which is a signal for glycocalyx altogether. So here we have a mechanism that we thought was happening, but because the Vigabatrin actually exacerbated the effects of glycocalyx shedding, we did some additional research and found out there's an enzyme that's specifically upregulated in females as opposed to men due to estrogen. And that enzyme is actually the exact same enzyme that Vigabatrin happens to work on. So in the following sets of experiments, we did the same thing with female rats, and it kind of proved what we were looking at originally. So the Vigabatrin did not help male rats, but in female rats, it actually masked some of the estrogen that was protecting the endothelial glycocalyx. So the Vigabatrin in females exacerbated the shedding as well. And that pretty much consolidated our second hypothesis, which was that females have an upregulated version of this enzyme that gives them that protective factor in trauma when they have that hemorrhagic shock. So that was pretty much the bulk of the presentation. I guess one thing that I should clear up is succinate. It's everywhere. It's in our non-pathological cells. It's in our pathological cells. But when it starts getting built, when it starts building up in concentrations that are pathogenic, that's when you start seeing it attack the endothelial glycocalyx and contribute to that shedding. So that's all I have. Thank you.